this is your house, but I want to thank you for hosting me. This is a place I've been to many, many times as lieutenant governor, but my first official visit with you as the borough president, and I want to thank you for the extraordinary leadership that I've seen from you, literally from your first days in office. That horrific fire where we lost so many innocent lives is still seared in my mind. The smell of the smoke and the anxiety. I came down immediately, and you were so literally on the job for such a short time, and you were out there with the people. You were out there just taking care of people. It was such a powerful visual reminder of how leadership matters in a crisis. And you were there. So we've deepened our relationship for over many years now. I want to thank you for what you're doing. And to all of you joining us here today, our elected officials who I just had meetings with, thank you for joining a conversation about something that maybe it takes the first mom governor to understand how critically and important it is for moms and babies to have a healthy pregnancy and birth. Right. And it's something that other communities can take for granted, but there are others, like the Bronx, which has the highest mortality rate overall, but highest infant and maternal mortality rate of the other boroughs, 9 times more likely to die in childbirth if you're a woman of color. I mean, you can't talk about these and hear about this and not feel compelled to take action immediately. So we have worked hard on this issue. I have prioritized it. I've talked about in my State of the Union address, elevating this crisis which has unfolded. And we have worked hard to find strategies. And we just had a wonderful tour with Mari Millett, the president and CEO of the Morris Heights Health Center. I want to thank you and your really passionate team. You know, the head of OBGYN we just took a tour with and walked and saw the people that are so committed, to support people like you. I want to thank you for all you do, doing such tremendous work. And I just want to say, sometimes it's about the people that matter. Sometimes a little extra money matters and can help. And so I also want to announce, while you're sitting here, to close the gap you need to expand the Morris Heights Health Center and bring back the services, $8 million for you today. I will say, Assembly Member Udelka Tapia, even when I'm marching with her in the Puerto Rican parade, all she kept talking about was the need to get this done. So she's been passionate, Councilmember Sanchez as well. Your advocacy has been powerful, but just going there today, I said, no, we need to do this. We need to get this funded, and I want to thank you for all you've done. We'll build a maternal health center of excellence. I want others to look at what we do here as the model of how we protect moms and babies and give them world-class health care that they deserve. So thank you. And we're going to continue. And here's to help, I've got another proclamation here. This is, and I'll sign this too because why not? This is a standing order for our second announcement that is being actually issued by the Commissioner of Health today. And what this does is it says it now expands. I announced this, but we had to do this officially. Now expands doula services by allowing people to use Medicaid dollars to pay for these services. Women on Medicaid. They don't need a referral anymore. They don't have to worry about the cost. That doula services, which have really stepped up into the forefront as a service that is indispensable for women to make sure that they have an advocate when they go to their appointments and ultimately child. There's someone who understands, it's culturally competent, there's people who understand the stresses, and someone who's been through it themselves often. So I'm going to sign this here right now and make this real official and say that going forward we're going to make sure that we are doing everything we can. And lastly, I want to talk about something that, as someone who had my own babies and had the luxury of being able to leave work to go for doctor's appointments, there are many women who do not have that. If you're minimum wage or working hourly or just any time off work means less money for you, that is an injustice. So we'll be the first state in the nation to allow for 20 hours of paid prenatal care so our moms can get to the appointments, and that is now official as well. So getting rid of co-pays and a lot of other areas, but that's enough for me. I want to hear from you, because as I continue to spend my time out in communities like this and tour facilities and talk to providers and the people that care so deeply about this, there's always another idea. There's always something else we can do. We have a doula directory now because of conversations like these. We're making sure that we take care of so many different areas, but I'm going to listen now to hear what people have on their minds, and I'm going to take very good notes. But also, Borough President, let's hear what's on your mind as well, and thank you again for hosting this. I know this is such an important cause for you. We've talked about it nonstop, and you are one of the reasons why we are championing this in Albany, because your voice has been heard.
Thank you, thank you, thank you. Thank you, Governor. We appreciate your leadership and your commitment and dedication as the first mom governor in the state of New York. It gives me a great deal of pride and privilege to sit with you as the first female borough president here in the Bronx. And I welcome you here to Bronx Borough Hall, and official bienvenidos. Buenos dias a todos, to each and every one of you. On behalf of my team, the Office of the Bronx Borough President, our Deputy Borough President, Janet Peguero, our Chief of Staff, Justin Cortez, and the entire office, we are excited to welcome you and your team here to Borough Hall. We have not had a governor visit Bronx Borough Hall in quite some time. So not only is this historic, but it's profound for a reason, because we are aligned together in our overall goals to make sure that we provide comprehensive maternal health care for all women and birthing individuals in the state of New York. And the Bronx is a significant part of that. And to the members of our Bronx Maternal Health Consortium, our co-chairs, and all the members who are here, to my colleagues in government, Assemblymember Yudelka Tapia, Councilmember Pierina Sanchez, welcome. Thank you for being a part of this important conversation as leaders and women of color, and really everyone. Today is really a great day where we take a bold step in our collective work to ensure that all women, and certainly women of color, have access and opportunity. When we talk about balancing the scales of health care, this is from an equitable perspective and a justice perspective. For too long, too many women, Black women, Latina women, have been denied access to prenatal care, to comprehensive health care when it comes to birth workers, doulas, and midwives. And we've seen the data, we've seen the statistics, and we've somehow found, in the midst of all of that pain, we found purpose. And as the borough president serving for 3 years now, we've had many roundtables, and we've worked with the Bronx Maternal Health Consortium that we really inherited from my predecessor, Ruben Diaz Jr. I acknowledge the Diaz administration for starting this conversation. And now this is deeply personal. We are the only borough in the city of New York that is led by 2 women, and 2 women of color. So this is personal for us as leaders in this borough, in this county. We want to make a difference and set our families up for success and not failure. Giving them access to prenatal care, to doulas, working with many of our credible messengers like all of you, community-based organizations, healthcare partners that are on the ground every single day. And many times you're doing this work with very little recognition and very little government support. That is changing as a borough. We have a governor that recognizes your work every day and is giving you this moment to amplify your work and to talk about everything that you're doing as a collective. So I'm so grateful that not only are you here, but you're signing this order as a legislative body, as a former member of the State Assembly. I remember days in Albany, and the State Assembly and State Senate has really been a part of this work in terms of ambition and goals. And again, I bring up equity again because it is unacceptable. It's an injustice if any woman in our state is denied access. And Medicaid access and raising the reimbursement rates for our doulas was an incredible effort, and I want to recognize that as well. That was achieved last year. So a lot of great things are happening in the Bronx, and most importantly, I want to make sure that all of you get recognized for the work that you are doing, because at the end of the day, we are here to save lives. We are here to make sure that women and birthing individuals have safe deliveries as they become mothers, which is truly a blessing. And it's really an honor to serve and to work with all of you as we move this conversation forward. We've been talking collectively as a consortium about building out a birthing center for quite some time. It was a part of my first State of the Borough that we had, and we've been working towards an executive report as well as a birthing report. We've been working with healthcare providers and professionals. We've been working with many of you on how we can look at creative and innovative approaches to maternal health care, knowing that we have the data to prove that our work is not only worthy and significant, but it has made a difference. And we also do this in honor of those women that we have lost in our battle. We do it because we carry on their legacies. Women that look like us have died during childbirth because of pregnancy complications. And we are honoring their work, and we are making sure that their deaths are not in vain. And so I'm grateful, Madam Governor, that you were here. I'm grateful that of all the places our governor could have been in 62 counties in the state of New York, she's here in the Bronx. Because oftentimes when there are announcements made of money, of funding, the Bronx is not always leading that conversation. But we are going to lead that conversation now because we have a governor that aligns with our collective priorities. So I'm so grateful you're here. I'm looking forward to our roundtable this morning and really hearing from all of you. And thank you so much for your work. Thank you for never giving up on the Bronx, for looking at the potential that we represent and making sure at the end of this, we are working collectively together. I now want to turn this over to my amazing partner, who is about to give birth herself. As a new mom, a first-time mom, I'm so grateful that in her prenatal care, she is working with one of our doulas here in the Bronx, because she's going to be a great example for us on how we move this collective forward. At the Health and Human Services Division, our Deputy Director, Maknoor Jara, and her team have been doing this amazing work with our policy team and everyone in the office. And so I now turn this over to our Madam Deputy Borough President, Janet Figueroa.
Thank you so much, Madam Borough President. Thank you so much, Madam Governor, for loving the Bronx time and time again. Always have, and I know you always will. Your commitment speaks volume, from economic development, the Kingsbridge Armory, to now, your support around maternal health, and rebuilding our anchor institutions. As the borough president mentioned, this is no longer a theoretical crisis for me. The moment I found out that I was pregnant, I was excited but also fearful at the data, knowing that there was a target on my life potentially. And that led me to work with the Bronx Street Birth Collective, my doulas, my doula collective team that's here, Evelyn and Nicole. Thank you so much. You've been doing this work since day one, and just welcoming women, encouraging women, and saving lives. And so part of my joy was that feeling of feeling safe. And part of that was working with my doula collective. So I want to thank them for being here and for doing the work and not turning women away because of their financial status. And so that Medicaid reimbursement is really going to be transformative. This is why I say the fight to end maternal mortality is a fight for life. And I believe that the measure of a society is how well it equips and protects women and children during this important life process. And so to this end, I want to extend my appreciation to you, Madam Governor, as I know that you have been a powerful advocate for New York expecting mothers, from your efforts on paid prenatal leave to the expansion of access to doulas. Again, this is going to be truly, truly transformative. The folks have been doing the work on the ground without that funding support, without that financial support, because we know how critical it is. And so I know that the advocates around the table will share some of that perspective with you, and I know that you will support that work, and this is only the beginning, and so we are forever, forever grateful. I am excited that my daughter gets to grow up in a world where women have been fighting and laying the groundwork for her safety, and so for that I am immensely and deeply grateful.
Beautiful remarks.
Thank you, Madam. Thank you, Madam Deputy. We are so excited to have with us, of course, and thank you for that announcement. That was quite a surprise. What a Monday morning. What a way to start this incredible week with an $8 million capital investment at Morris Heights Health Center. So I think that I have an incredibly long relationship with MHHC because I've been around for over over 20 years working with all of the presidents and CEOs and the staff at Morris Heights Health Center. We've done a lot of work around maternal health, women's health, behavioral health, mental health services. We've done health fairs, resource fairs. We've done a tremendous amount of work in the Morris Heights community. And then I've watched you grow. Harrison Circle, the work at the Walton Family Care. You also have a healthcare center in Brooklyn. And you are just moving all around the city. And that really speaks volumes to your leadership and really your collective commitment to make sure that affordable and quality healthcare is achievable for every New Yorker and every Bronx family. For that, we are so grateful. We look forward to working with you and your team as we receive $8 million to expand. But I want to recognize our very own president and CEO of Morris Heights Health Center, Madi Millet.
Thank you. Thank you very much. Governor Hochul, you have saved lives today. Your generous donation has saved lives. You know, the Bronx is a very interesting place to live, so much so that I would say to survive. And the baseline of healthcare in the Bronx is not the baseline of healthcare in other boroughs, where access to healthcare is so different. And so you could only imagine that a woman giving birth to a child or even getting pregnant, the challenges that woman comes to us with from her baseline health. Forget about the pregnancy. Just the fact that she hasn't had access to a provider. She hasn't been taking care of herself because of all of the other social drivers, that she has to take care of her grandparents and her parents and her children and not even herself. So we receive these young ladies in a compromised state to begin with. They don't go to their doctor 3 times a year to have annual physicals. And so what you've done today is you have helped us come full circle. We try our best to do our best with what we have, but you have given us so much more that for me to sit and explain to you what you've done for us would be difficult to put into words. Morris Heights has always believed and known that we cannot do health care as we typically would. Health care for us is a whole health approach. It's looking at all the social drivers. It's looking at where people live. It's looking at what access to food people have. It's looking at doulas. It's looking at a hand-holding experience for our community. And so being able to build this integrative health center where everything is incorporated in one building has never been done in the Bronx. It will be the first time you can come in, you can learn how to go to college, you can learn how to fill an application to get a job, you can learn how to take care of yourself, you can learn about how to prepare the foods that you need to eat, you can learn how to prevent chronic disease because because your parents or grandparents have diabetes, it doesn't mean that you have to have it. So all of those things are going to happen around those 4 walls, and you have made it possible today.
Thank you.
And so we thank you. We thank you so much.
Appreciate all you're doing.
Oh, thank you. And I have to thank my legislators, the borough president, the assemblywoman, the councilwoman, because without all of you together, working together as strong women, we wouldn't be here today. So thank you.
Thank you, Mary. We really appreciate it. Morris Heights Health Center is a part of the fabric of this great borough. We're also building a new health center in the Northeast Bronx. Very excited about that. And I've watched you grow, even serving beyond Morris Heights. That was the foundation. I lived in Morris Heights for 15 years. And I have watched the cultural sensitivity, the holistic treatment, the creative and innovative approaches, the comprehensive health care that you have provided to residents and families. And for that, we are all truly grateful.
I appreciate that. Thank you.
Excellent.